If you live in Toronto and you have tinnitus, you've probably searched for something like this: tinnitus cures near me. And then the internet gave you 47 tabs. Three of those are magical supplements. One is a sound machine. And then one is the story of a guy who cured his tinnitus eating pineapple upside down. So today, let's cut through that noise and let's talk about what are real tinnitus management options in Toronto. And just as important, what should you be careful about? Now, of course, before we dive in, I want you to make sure you like this video and subscribe to our channel. My name is Dario Coletta. I'm an audiologist and doctor of audiology, and I've helped hundreds of people in the Toronto area to achieve better hearing and also solve complex cases of hearing loss. I've also had the opportunity to work with hundreds of people to help improve their tinnitus. First, I want to say the honest thing. For most people, tinnitus is not treated with one magic cure. It's managed with a plan. That plan depends on what could be causing it. How long has it been there for? Is there any hearing loss involved as well? How much distress is it causing you? And are there any medical red flags that we need to investigate further before we proceed? So, the first option is going to be a proper tinnitus and hearing assessment. The last thing we want is, do you hear ringing? Great. Here's a brochure and you just have to live with it. A real assessment is going to look at your medical history, a hearing assessment, and not just a hearing screening. We want a full hearing assessment. We want to know, how well are your eardrums working? Is your hearing normal, or is there some degree of hearing loss? What are your speech clarity scores? What sounds do you find to be a comfortable level, and what do you find to be an uncomfortable level? I also want to look at lifestyle, stress. What are your sleep habits? And anything that can warrant a referral. Now, tinnitus guidelines often recommend that we start with a hearing assessment. And this can be strange for people sometimes, where they call the clinic and their primary complaint is tinnitus, but we're asking them to schedule in for a hearing assessment first. And that's important because whether you have normal hearing or some degree of hearing loss, that's going to dictate, well, what are the ways we can better manage your tinnitus? But part of it as well is oftentimes hearing concerns or complaints can be disguised as tinnitus complaints. And so we'll often see a lot of tinnitus guidelines recommend a hearing assessment and managing any hearing related complaints. So that can be things like amplification. So if you have a hearing loss, we're going to do a trial with hearing aids and see how those symptoms improve. We're also going to look at how can we implement sound therapy. One of the most useful ways to implement sound therapy if we have a hearing loss is hearing aids. Otherwise, if we need to supplement when you're not wearing your hearing aids, or if you have normal hearing, we need to think about ways in terms of what do you already have in your environment that you can implement, or what are extra tools that we need to access in order to implement sound therapy effectively. And psychological support. This is often one we overlook, but a large part of why people are concerned with their tinnitus isn't actually the loudness or the ringing sound itself. It's more so, what does that sound trigger? Because oftentimes it usually triggers a negative response like anger or frustration, and that we need to address. Part of a hearing assessment for tinnitus is going to involve more than just what are you doing in the booth and what are those results. We want to look at validated tinnitus and hearing questionnaires. That can shed a lot of light on, is it actually a hearing concern or is it a tinnitus concern? Is there some level of sound tolerance that we need to address first before we can proceed with tinnitus or hearing concerns? We also want to understand, what is the impact of your tinnitus on your day to day? Are there any scenarios that you're avoiding? Are there any aspects where your tinnitus is impacting you? That's not information that we can gain by testing in a sound booth. That's going to be validated answers to questionnaires. These are also great tools because we can use these to reassess and actually measure how much improvement we're seeing over time. And honestly, a questionnaire that helps us to understand what is your experience with tinnitus is going to be far better than having you sit in a quiet room and think about your tinnitus on an average day and we try to measure the pitch and loudness. It's not really a helpful tool for us, but it's definitely not a helpful tool for you in learning how to ignore your tinnitus. Now, option two, a medical referral when needed. Most tinnitus is not dangerous, but some tinnitus symptoms need medical attention or require referral to an ear, nose, and throat specialist. In Ontario, a referral to an ear, nose, and throat specialist is generally going to go through your family doctor or a walk in clinic. Audiologists in Ontario are not allowed to refer directly to an ENT specialist. Now, when does tinnitus require a medical referral? We're looking at sudden onset tinnitus. Is it only occurring in one ear? Is it associated with a sudden hearing loss? And does it have a beating sound similar to your heartbeat or what we call pulsatile tinnitus? And of course, if it's accompanied with dizziness, facial paralysis, or any neurological symptoms, that's not something we want to wait on. Do not sit around trying rain sounds. The recommendation for an urgent ENT referral is if tinnitus accompanies with a sudden hearing loss occurring over 1 to 3 days. That's technically considered a medical emergency that you do not want to wait on. That is a get assessed properly situation. 3. Hearing aids when hearing loss is part of the picture. This is one of the most common things that people miss. They think, I have tinnitus. But sometimes the bigger picture is actually this. I have tinnitus, but I also have untreated hearing loss. When our brain is missing sound input, sometimes we can notice our tinnitus as being louder. Hearing aids are really helpful tools. And this can sometimes be a bit of a tricky conversation. We get people who come into the clinic wanting tinnitus counseling, and then we uncover a hearing loss. And so oftentimes our first recommendation before we do anything else is the trial or the use of hearing aids. And sometimes the response is, well, you just want to sell me a pair of hearing aids. And no, I'm not here to sell hearing aids to people who don't need them. I'm here to prescribe hearing aids when I think they are appropriate and effective. Hearing aids and tinnitus are one of the most effective tools. If we're able to amplify sounds that you're not used to hearing, you're going to have access to all of these sounds. That's going to create a richer sound environment, which is going to reduce your perception of your tinnitus. It's also going to alleviate some of those complaints that we thought were related to your tinnitus that are actually related to your hearing. Hearing aids are also going to help to reduce listening effort. So we're purely just going to be less tired at the end of the day. And of course, hearing aids also have sound therapy built into them as well. But hearing aids are not magic and they need to be fit properly. As an audiologist, one of the very first things I do with somebody when we're addressing their tinnitus with hearing aids is I purely program their hearing aids using real ear measures, which is the gold standard, based on their degree of hearing loss. I don't implement any sound therapy strategies right away. And one of the first things most people will say is when we turn on their hearing aids is, yes, of course, I can hear better, but I don't notice my tinnitus as loudly. It's almost like they relax. Now, of course, if people come back for their follow ups in the future and they say, hey, my hearing aids are helping me, I'm hearing better, I'm noticing my tinnitus less, but it's still bothersome. Well, that's when we can then activate some of those sound therapy features in our hearing aids. And of course, those are also things that you can do as home as well. And that's actually number 4, sound therapy. This is going to include things like white noise, pink noise, brown noise, nature sounds, fans and dehumidifiers running in our bedrooms. These can be apps built into our phone, bedside tabletop generators, and of course, like we talked about, hearing aids. Now, with sound therapy, I want you to remember the goal is we're not trying to drown out our tinnitus. That's never the goal. We want to learn how we can live with it. The goal of sound therapy is let's reduce the contrast so that our attention is not focused on our tinnitus like an emergency alarm. I want you to think about this example. Oftentimes, People's tinnitus seems louder at night when they're trying to fall asleep. Now, is it really louder or is there more contrast from our quiet bedrooms and our tinnitus? Generally, most people's tinnitus is the same volume throughout the day, but the sounds around us, all the visual distractions take our attention away from our tinnitus onto other things. And so we don't perceive it as loud. When we slow down, when we relax, when we try and fall asleep, laying there in a quiet bedroom is going to highlight our tinnitus. So, if we can put a little bit of low level noise into these environments that we find to be challenging, we're going to help to reduce the contrast so that falling asleep at night, waking up in the middle of the night, or waking up in the morning, the first thing we're hearing is not our tinnitus. Now, of course, how to implement sound therapy? Well, that's going to go based on what environments have you identified as being problematic. And you're going to work with your audiologist or hearing healthcare provider to identify those scenarios, talk through what could be helpful tools. And then once implemented, you're going to revisit and reassess. Think about, well, what worked well, what didn't, and what can we adjust? And you kind of go again. 5, cognitive behavioral therapy, so CBT, or tinnitus focused counseling. Now, this sometimes is a bit of a tricky situation, or sometimes people can feel a little bit defensive. And I get it. But are you trying to tell me this is psychological? Is it all in my head? No, I'm not. I'm saying tinnitus is a real sound perception, and your nervous system's reaction to it matters. Cognitive behavioral therapy is evidence based to help with tinnitus. Sometimes our reactions, so our emotional reactions to tinnitus, can be negative, and that can cause us to perceive our tinnitus as being louder. If we're able to change our mindset and address tinnitus situations in a more positive light or be able to change our thinking around it, then it may not be as impactful. And I tell patients all the time, CBT is great for tinnitus. It's really effective. But the tools you're learning for tinnitus can also be applied to any distressing symptoms in the future, right? Although you're learning how to manage your tinnitus with CBT, of course, in conjunction with your audiologist and sound therapy, the tools you learn from your CBT provider can be carried over to different environments or for different things. CBT or counseling does not mean that the sound is fake. It means we're helping your brain panic less every time it hears it. 6, tinnitus retraining therapy style approaches. You may have seen this online. There's formal tinnitus counseling programs. The most common one you'll see is tinnitus retraining therapy or TRT, or the one that we use in our clinic is progressive tinnitus management or PTM. Now, most formal tinnitus counseling programs are going to incorporate both sound therapy, generally through an audiologist, and some form of counseling. Now, maybe some of that is minorly led by an audiologist, but then generally the rest is either a psychologist, a psychiatrist, or a cognitive behavioral therapist, like we've talked about. The idea is we want to help your brain habituate, meaning our tinnitus becomes less intrusive or less noticeable. The goal is not for it to be gone overnight because a big part of tinnitus is we have to be realistic, but we want it to be less powerful or less noticeable. That's often the real goal. And I'm frank with people, and I think it's important for tinnitus counseling to set realistic expectations. Our goal for tinnitus counseling or management is not that we're going to eliminate your tinnitus, but we want it to be less noticeable to you. Now, what should you be careful about? Be careful with anybody who's promising you a guaranteed cure. Cure is not a word we use in tinnitus management. Be careful with expensive supplements marketed as secret science. There is no herb, there is no pill that we can take to eliminate our tinnitus. Be careful with anybody who skips a hearing test. And be careful for anybody who treats tinnitus exactly the same for every person. Your experience with tinnitus is unique to you, and your treatment plan should reflect that. Toronto has audiology clinics, hospital based hearing services, tinnitus clinics, and mental health professionals who may support tinnitus related anxiety, sleep difficulties, or distress. For example, Toronto based services publicly list tinnitus management or tinnitus treatment as part of their care offerings. If you live in Canada, you can go to the Canadian Academy of Audiology's website and you can actually find providers of tinnitus management on their website. So, what are your tinnitus treatment options in Toronto? Start with an assessment, rule out medical red flags, treat hearing loss if it's present, use sound therapy strategically. Consider CBT or counseling if tinnitus is affecting your sleep, mood, or quality of life, or if you just want to better manage it. And avoid miracle cure marketing. The goal is to understand it, manage it, and take away its power. Subscribe to our channel, like this video, and share it with somebody who's been told they have tinnitus and they just have to live with it. Because just live with it is not a treatment plan.